Salatogenesis is the focus on health as opposed to pathogenesis where we are focusing on the pathology. So here, in my lecture today, followed by a session in which we will be doing a few simple practices we can do from the chair, I would like to stress upon us again resetting our focus, our perspective away from pathogenesis and let us go back to salatogenesis. Because the people who are coming to us, our patients, they want a sense of well-being. If a patient comes to me and I am giving him the treatment or giving her the treatment, and when they come back with the reports, I say, all your reports are perfect. Blood sugar normal, blood pressure normal, your LDL, HDL, everything is normal. And the patient says, Doctor sir, I am not feeling normal, I am not feeling okay. No, all your reports are normal, you should feel okay. This is how normally we are approaching it, because we have moved towards treating the report rather than the person. And what does the person feel like? They want that sense of ease. Tamila sollapona sugama irukren. And the sugam என்பது sukha in Sanskrit, the word is sukha, in Tamil sugam. That is what we want. And this is why our focus at our center since 2010 has been on moving from pathogenesis to salatogenesis and trying to help people understand how they can be healthy, why they should be healthy, and if you have lost your health, how can you once again regain it? Between the universe and us, it is only our ego, it is only our ignorance, avidya, anavam, agandai, mummalam is how Tirumula has talked about it. That sense of I am different than you. Where does disease come from? Disease is a moving away from that state of ease where we are all one. If I feel you and I are one, can I feel jealous of you? You get a promotion, I'll be happy. But when I feel you are different than me, I say, how can he get promoted? I should get promoted. How can he get the prize? I should get the prize. Today when I was giving away the prizes to the prize winners, I was happy with them, not just for them, I was happy with them. You should be happy for others because you are all one. We start to understand, as our ancients have said, Vasudhaiva Kudumbakam, the whole world is one family, or as our great Tamil culture says, Yadum Ure, Yavarum Kele. Now why should we use salatogenesis? That is my question here. Because if you are not bad, are you good? If you are not poor, are you rich? If you are not hopeless, are you hopeful? If you are not dissatisfied, are you satisfied? If not ill, do you have health and wellness? And if you don't flunk out, are you a good student? No. Because health, being good, wellness, richness are something very different. And this is why when we look at the illness-wellness continuum, we realize that we have a high level of wellness at this point and premature death and others on this side. And the wellness paradigm tries to shift us from this premature death, this side, to wellness, whereas here we are constantly battling here. As doctors, most of the time the patients come to us only when they are near here, and we are struggling to get them back here. And that is why it is important to once again shift our focus from pathogenesis to salatogenesis. Now, in modern times, we all being in the medical profession, in fact for me, I belong to the medical profession, I belong to the yoga profession if you want to call it, I belong to the artistic community, and so I find myself bridging a lot of things as a human being. But one of the major questions is restoring the values in medicine. Because the father of medicine in modern times is William Osler, and what did he tell us? Not the Vedic tradition, not the ancient Greeks, not the Europeans, not the Africans, not the Mayans. William Osler says the good physician treats the disease. The great physicians treat the patient who has the disease. We need to understand the person person as a whole. And this is where the concept of holistic medicine comes in. Now I don't have to tell you, but just a few incidents recently you all have seen, with the dog being thrown off the building and the monkey being tortured to death by our own future doctors. As a person in the medical profession, I am scared. What type of doctors are those people going to be? Are they going to have empathy? Are they going to have compassion to help those who come to them in need? This is where we need to change some of our ideas and try to be a good human being. That is what yoga is all about. Trying to be a good human being. Abhaya tells us, and in that the highest of the humanity is Dhanam Davam Seidal. The one who is capable of helping others, giving dhanam and being disciplined, that is tavam. Now that type of human being is what yoga is trying to give us. Yoga is not just a system of exercise, as I hope you will understand by the end of my talk. Now my question is, shouldn't our doctors be good human beings? Before we become qualified doctors, I think we should first be good human beings. Because if you are not a good human being, how are you going to be a good doctor? How are you going to be a good engineer? How are you going to be good at anything? I think the essential prerequisite is for us not to just be, as Aristotle said, featherless bipeds. Aristotle 2000 years ago said, human beings are featherless biped. We are walking on two legs like chickens, but we don't have feathers. He basically called us bird wings. He insulted us actually, featherless bipeds. We should regain our humanity. That is the point I am trying to bring here. Now, I wish I could see an image like this from an Indian hospital. But as usual, we in India, because of our colonial hangover, we wait for the Western country to certify that it is good and then we'll accept it. But already, look there, in countries like USA, in countries like America, in all the European countries, the doctors, the nurses, all the health professionals are practicing yoga. Because they have found it enhances their sense of well-being, makes them a better, more competent, skillful human being who can withstand the stresses and strains. Now here in yoga, not only the physical part, but we have something called Yama Niyama. According to Tirumula, it is Iyamam Niyamam. He gives us the system of Ashtanga Yoga, the 8 limbs, with Iyamam Niyamam. Patanjali gives Ashtanga in the Sanskrit version with Yama Niyama. And it is the restraint of subhuman tendencies. How not to be subhuman. I am not using the word animal because sometimes I think animals are better than us. So I won't say animal tendency, subhuman tendencies we should restrain and develop the humane qualities. Now, what are the components that we are looking at? One is what is called Achar, healthy physical activities and exercise. Now you know what, we doctors are always advising our patients to do exercise, go for a walk and all. But how many of us are doing it is a very big question. And this is the problem that we have, because we are advising people but we are not doing it ourselves. If we are not doing it, there is a story of a mother taking her child to Gandhiji and saying, Gandhiji, Mahatma, please tell my child not to eat sweet. He said, come after 2 weeks. She didn't know why is Gandhiji saying come after 2 weeks for something simple. After 2 weeks she went back and Gandhiji told the boy, don't eat sweets. It's not good for you. She said, Gandhiji, Mahatma ji, you could have told him this 2 weeks ago. And Gandhiji said, at that time I also was eating sweet. So for 2 weeks I had to stop eating sweet before I can advise him not to eat. I think it is a very good example to take from the father of our nation, Mahatma Gandhi. The second part, what type of thoughts are we having? Are our thoughts always negative? Are our thoughts of jealousy, anger, pride? Or are they thoughts which are vital for well-being? The type of food we eat, excellent food today, I congratulate you on a wonderful meal, but it's very difficult after such food to stay awake. Because hyperglycemia is a major issue post-prandial. And always, wherever I go, I keep on being given lectures after lunch. So I don't know, and the post-prandial lecture da enkita adigadi kudupaanga. So once again today we have that, but I will try to keep you awake. And the last one is, how do you relax? You ask most people, how do you relax? Sir, I go and watch a movie. I go and watch television. When you are watching television and a movie, you are not relaxing. Your body systems are responding to whatever is happening on the screen as if it is happening to you. Your blood pressure is going up. When that person is getting tension on the screen, and all our women, evening aayitala podum, they don't know who is in house, who is come, who is gone. Ella the TV da. What happens? You are so transfixed in it, you think, and what's happening? And we think we are relaxing. See, this question of relaxation is where yoga comes in. Yoga affords conscious relaxation as a great adjunct to all psychosomatic stress-based disorders, which are the lifestyle non-communicable NCDs of today. Now yoga gives us 8 basically limbs. The yama niyama, the first 2, help develop social health. You know, when we talk about health, we say it is not merely an absence of disease or infirmity, but a state of physical, mental, emotional, social, spiritual, financial, add all the adjectives you want, health. State of well-being. That state of well-being, the social is through yama niyama, being a good human being. Asana pranayama give you the physical health, pratyahara dharana the mental health, and samadhi dhyana for the spiritual health. So all around health being given by yoga. What are the mechanisms by which yoga may be working? Well, we are looking at the asana. Asana, most people think that yoga is asana. Is this mic capturing enough, or should we put up the volume? I'd like to move a bit. Little volume for this one. Now most people are thinking of only the asana. If you say yoga, immediately what comes to your mind is some asana. His leg is above the head, or he is upside down. That is what you are normally thinking. But there are many other techniques, such as the pranayama, and today I am going to introduce you to a few of these pranayamas, which are the techniques of controlling your energy. Can you hear me, or seeming a bit weird? Fine. And what we are trying to induce is that we all know about the stress response. We are trying to induce what is called the relaxation response. It is the exact opposite of it. And we are trying to go against this tendency, you know, this me first, make the most money, who cares as long as I am safe. This is the attitude that is coming, that is harming us. And this is where the most important word as a doctor is empathy. Now we all know about sympathy. What is sympathy? You go and jump in the well with the person. You cannot help them because you are in the well with them. Now there are 2 people who need to try kapathapa, two people have to ask. Now the third part, and middle part is empathy. You are safe and you are helping the other person, but you are feeling for the other person. They say put yourself in the other person's shoes and think. That is empathy. But you have that objectivity. But then most of the time what is happening, we are developing apathy. Apathy because why should I care? I don't want, let some unit 1 to take care or unit 3 take care. Is the child 11 or 12? Should it go to pediatrics or should it go to medicine? We all know this, right? Right from my days doing internship in Chennai till now we deal with this. Push it to somebody else. This is called apathy. Sympathy is, you understand, it's a human being. Even if my duty finishes at 8 o'clock, isn't it a human being who is suffering? Shouldn't I help that person? That is called empathy. Now of course, you should not kill yourself for somebody else, okay? And you have to understand there are times we need to pass to the next person. And this is why when we are at peace with ourselves, if you are at peace with ourselves, we can serve others better. If I am full of tension like this, imagine I am like this. You think I am going to help anybody? If I am jumping, casualty emergency, we cannot do for anybody because we are like that. So So finding that peace for yourself, being at ease, and the more we give, the more we receive. Something that my father taught me when I was 4 years of age. And 40 years later, I still am learning that every day. The more you give, the more comes back. Be it love, be it respect, even money. Recently I told somebody that and they said, okay sir, you give me 1,000 rupees, let us see if it comes back. I said, if I give it to you, you will not give it back, but 10,000 will come from somebody else. And I have seen that a lot. But we keep on expecting from the same person. I gave him respect, he is not giving me respect. I gave her love, she is not giving me love. I gave that person money, he is not giving back. But we are getting from 10 different people and we are not seeing it because we are so limited. Like putting our eyes on a microscope, you don't even know your professor has come in, you are so engrossed in your microscope. Okay. So what are some advantages of yoga here? Preventive, promotive. Is it curative? Well, once in a while maybe, if in an early condition. But I don't go around saying yoga will cure everything. Because if you don't understand the limitation of your system, you will never grow the strength of your system. It is only when we know, I don't know, can we learn. And in South Africa, I was told there is a proverb, only the fool knows everything. And I think it's a very good thing to remember, that if you think you know everything, well, be careful. The positive side benefits. What happens is the patient comes to us for the hypertension, they start the yoga practices, side by side, some other parts of their problem get solved. They start to sleep better. They find the interpersonal relationships are better. They find that one of my patients, he was diabetic. And he said, sir, after doing the yoga, what used to take me 3 days to do, I can do in 3 hours. I have become efficient in my day-to-day work. This was not the therapy we were giving. The therapy was being given for diabetes. But side by side, what happens? Other parts of the life start to get enhanced. We call them the positive side benefits. And the most important thing is this, relief from stress. Because the yogic concept says that all the diseases start in what we call the adi, which is the psychic element of psychosomatic disorders. And today we understand in modern medicine, virtually every disorder has some component of psychosomatic distress as part of it or stress as part of it. And this coming down, creating the diseases is the yogic concept, which can be understood by our fight or flight or freeze response. So a saber-toothed tiger is chasing the caveman. He has stress. You need the stress to keep yourself alive. And either you fight or you flight, or of course the psychological one is freeze, and you deal with your stress that way. Now in those days, you got up in the morning as a caveman, you came out of the cave and there was a saber-toothed tiger, and so it started chasing you and you either fought with it or you ran away, your stress was solved. But what is happening today? You get up in the morning, you look at your mother, father, husband, wife, daughter, sister, and you see a saber-toothed tiger. You go to the traffic, you see many saber-toothed tigers driving vehicles. You come to your office, you look at your boss, it is a very big saber-toothed tiger. The professors go to the classroom, they see 100 saber-toothed tigers, or 150 or 250 depending on MCA's benevolence. Saber-toothed tigers sitting out there. What is happening? Constantly saber-toothed tiger response, stress response, stress response, stress response, stress response. You are getting stressed for everything from morning to night. How do you ever hope to be healthy? And this is where we start to realize that this entire stress response, be it through the cortex or the medulla of the adrenal, all starts where? Perceived stimulus. You have to perceive something as stressful for it to induce the stress response. And the entire stress response comes in. And again I must tell you, stress is not bad. So yoga is understanding you need this middle path. Krishna tells in the Bhagavad Gita, Yukta har viharasya, Yukta cheshtasya karmasu, Yukta swapna bhavavadasya yogo bhavati dukkhaha. When there is moderation in everything, yoga is the moderate path. It is not too much, it is not too less. And in stress we understand that. We understand that we have this point here. Less than that is of no use, more than that you are getting burnt out. And this is where I would like to again come back to the salutogenesis concept, where you see that there is a stressor and you have the tension. Now there are two things that can happen. One is pathogenesis and your breakdown, or the two is salutogenesis and you develop positive health. What you are doing is you are using the stressful challenge. By changing your attitude towards that, you are using it to become healthy. It is like exercise training. It is like inducing yourself. It is like vaccination. We have to look at the effects of yoga which go against this system. It tries to retard this stress response by inducing a relaxation response. Now this entire stress response, which is dealt with by adaptation, that is called allostasis, leading to the allostatic load and disease. All of it starts at this point. And I would like to take 1 minute here to stress this point, because we often say, "Yamma tension irukkinga sir, en pondati seriyilla sir, yamma tension irukkinga en veetukar seriyilla, pasanga seriyilla, appa amma seriyilla, teacher seriyilla, college seriyilla, management seriyilla, student seriyilla, traffic seriyilla, naadu seriyilla, PM seriyilla, ainur ayam selladu, something or the other." We keep on blaming on others. What is happening is we keep on blaming our stress response on others. Now I just want to ask you a simple question. You all have friends, you all have people who have studied with you, your colleagues, your co-students. When your friends who you have been friends for like 5 years, 10 years, or people who you have known from school days, when you meet, do you use only good language, or do you use some very, very nice, choicest bad language when you talk to each other? We use some very, very beautiful bad language. It is a sign of bonding, nanbanda. And those words are used to indicate your closeness, your bonding. When I was studying in Nagpur University in Varda, when I used to go back after holiday, all my seniors and my friends would be standing in the hostel. As I went with my bag, they would all start choicest abuses. Bengali, Marathi, Tamil, Telugu, Hindi, Gujarati, Punjabi, all language abuses I know because I used to get that. All they will be abusing. But you know what? I used to have a very great feeling of Anandam, Paramanandam. Why? My friends are welcoming me back. They have missed me. I was actually having a relaxation response. I was having an endorphin, enkephalin high. I was feeling high actually. Now, imagine I'm going on the road and somebody I don't know utters one of those bad words. Will I have enkephalin and endorphin high? Sympathoadrenal high. Adrenaline, noradrenaline, and what do I do? It is not a word. It is your perception of the word, of the person who uttered the word, and what lies behind it. Your perception determines whether you will get stressed by it or not. And that is why I often say, nothing can stress you unless you allow it to stress you. You are the master, you are the decision maker. And if you let it stress you, God help you. Because once you let it stress, once this starts, your whole sympathoadrenal, hypothalamus, pituitary, adrenal, your sympathetic autonomic nervous system, all the responses will come in and then it is too late. வெள்ளம் வந்த பிறகு போயிட்டு பக்கெட்டை வச்சு தண்ணி ஊத்துற மாதிரி சென்னையில ஒண்ணும் பண்ண முடியாது. Before that dam breaks, you have to stop it. And that is why the change in the perception is where yoga is trying to work. And I want to remind you, when we talk about stress and the difficulties and obstacles and challenges, a diamond is just a little piece of charcoal that handled stress exceptionally well. What is in a diamond? Carbon. What is in charcoal? Carbon. What is in graphite? Carbon. What is in you and me? Carbon. We are all made up of carbon. That's why they do carbon dating. So if we are also carbon, the piece of carbon that said, I will take up the challenge, it became the diamond. The one that said, maybe I will take, maybe I won't take, it became graphite for our pencil. And the one who said, the one who said, I am not going to do it, that became charcoal that is used in our burning. What is the difference? Us taking up the challenge and saying, come on, test me, I will do it. And remember, every challenge that doesn't kill you, I repeat, every challenge that doesn't kill you makes you stronger. So, if it kills you, it's over. Why worry about it? Jayalalitha has no problem now. Okay, she is at peace. It's the rest of the people who have the problem. Right? Including us. Anyway, sorry. I try to be non-political. But see, once you go, there's no problem for you. So if that is so, right, and if it hasn't killed you, it has made you stronger. So then why are you upset about the problem? I often have people come to me, sir, I'll translate here. I have so many problems. My life is so bad. My life is so bad. My husband is so bad. My kids are so bad. My job is so bad. My students are so bad. This is so bad. This is. But look at her, sir. Such a good husband, sir. Such a nice house, sir. Pasangala eppudi padikudhu sir. Nalla padikya pasang paaru sir. Yani siripa vandukkom. Why I am laughing, you know? The person she is talking about would have come to my office 1 week ago telling all her problems. But வெளியே தெரியாது. So வெளியே இருந்து பார்க்கும்போது இக்கவே மாட்டு இருக்கு அக்கவே பச்சை. The grass is always greener on the other side. Things look better in all other medical colleges always than your own. When you go there, you realize everything's one and the same. Anyway, that's a thing to be ignored, okay? Not to be meant in any other way. See, what happens is that we always have this comparison. You want a sure-cut formula for disappointment? Do you want a sure-cut formula for disappointment? Well, the formula is please have expectation. If you have expectation, guaranteed disappointment is going to come. Expectation, disappointment agum. Don't have expectation. That is what Krishna says in Bhagavad Gita. Nishkama karma. Do your duty for the sake of doing your duty. It is like in Zen they say, what is the sound of one hand clapping? So immediately people will try to make answer. The sound of one hand clapping is the sound of one hand clapping. That is the answer. Think about it. The sound of one hand clapping is the sound of one hand clapping. Finished. That's the answer. But we keep on wanting to find something else. Because we are never satisfied. And that is where one has to be very careful. Because disappointment comes from expectation. So in yoga we give the physical therapies such as the asanas, the postures, mudras, the kriyas, the bandhas. Emotional therapies. Swadhyaya, this is self-analysis. Suya, nokam. Looking at yourself. Where are you? Who are you? What are you doing? That type of self-awareness. Pranayama, the pratyahara, which is sensory withdrawal. Coming to become the master of the senses rather than being a servant of the senses. You see something, you react. You hear something, you react. Instead of that, you be able to decide whether or not you will respond. Reaction is at the spinal cord brainstem level. Response is at the neocortical level. As a human being, we should develop response. Because ability to respond is responsibility. And as a human being, When we live as a human being, we respond rather than react. React is you hit me, I hit you. You scold me, I scold you. You throw a stone, I throw a stone. That is reaction. That is like the knee jerk. You hit, I kick. You hit, I kick. You hit, I kick. This is down at spinal cord level. It is not here. Here you can make a decision. Should I kick or shouldn't I kick? Should I respond or shouldn't I respond? Then the mental therapies, which are the relaxation, visualization, we use a lot of those therapies. Spiritual therapies, Swadhyaya, again introspectional, self-analysis. Ramana Maharshi in Tirunamalai said, Nanya. He said, Summa, be quiet, be silent, be still, and ask yourself, who am I? Koham, in Sanskrit it is asked. Satsanga, meet with good people, meet with people who have something higher aspiration. Again, yoga for me is very important as a preventive therapy. Starting early in childhood, preventing accidents, the more body intelligence you have, the more responsiveness you have, the more you can avoid accidents and avoid tragedy in accidents also. Improved immunity, and also you know the technique. Later on when you are 35, 40, if you get the disease, you can do the technique because you have been doing it from childhood. So it's always good to start in childhood. We use it in rehabilitation with people who have learning disorders, the kids, as well as stroke and cardiac rehabilitation. And of course, pain tolerance, improved quality of life in the terminal conditions is very useful. Now, our Professor Madan Mohan sir, who is my yoga research guru, started introducing it in JIPMA in 2008 for the medical students, and you can see the medical students doing the yoga at that time, which we have continued at SBB. This is last year's batch, first year MBBS students doing yoga. You will see Meena there, who's sitting in that corner doing it, and again the evening classes for the students, and a similar scientific committee meeting introducing yoga to them. And this year's SBB, our festival with the students. Again, the idea is get these students to have that interest in their own culture. And of course, now yoga has become very popular. One of the reasons I'm standing here today is because yoga has become so popular that a medical college would like to know a bit more about it for its people. This is how things are growing thanks to the efforts of Modi ji, who got yoga day on June 21. And you can see what happened to Rajpath. It became Yoga Path in Delhi, and of course him also doing it with all the people from the year before. Now what is happening here? We are going to do some practices, but we are integrating breath-body movement. So in yoga, whenever we move, say I'm lifting my hands, instead of just lifting my hands, I am going to be breathing and lifting. So, and when I lower, I am breathing out. So it's not just, this is physical exercise. The moment I am doing it with breathing, slowly, consciously, mindfully, my mind is there. What's happening to my hands as I breathe out? What is happening? How are my arms coming down? What is happening within me as I do it? My mind is there, my breath is there, my body movement is there. So the mind, the breath and the movement are being integrated. Yoga can be defined as integration. And what happens is through this, you are focusing on the now. As you are doing this, you should be thinking of this, not lunch was very good today. Tonight can I go to a movie or not? If your mind is there, this is not yoga. It looks like yoga, but it's not yoga. Yoga is when you are mindful, being in the moment. And the body is still, the mind still, the breath is balanced, and all aspects of human psychophysiology, they start to improve. Now there are many practices. I'm not going to make you do these practices, but these are some of the practices. But what is very important in yoga is where the mind goes, the energy flows. Yato mana, tato prana. Where the mana, the mind goes, there the prana, the energy flows. And this is where we are using our mind to change the brain, to change the mind for the better. You can call it self-directed neuroplasticity. This is something that is happening by your own efforts.